Hello everyone, in this comprehensive lecture we will thoroughly cover two-handed dentistry. Two-handed dentistry, in contrast to the more conventional four-handed dentistry, can accurately be described as assistless dentistry, primarily due to the complete absence of a primary or first assistant. Regardless of the presence, teamwork, or specific skill of an assistant, the practitioner has significantly more freedom, which is precisely why it can also be accurately called assist-free dentistry. You can consistently perform procedures with your left hand, which understands you best and is most compatible with you in any situation, thus it also possesses the nature of stress-free dentistry. The two-handed dentistry I will introduce now can be applied not only to prep, but also to endo, perio, implant extractions, and all clinical procedures. Let's examine the three fundamental requirements for all dental treatments. Dentistry is surgery, and surgical procedures are a relationship between the operator and subject. The way the operator establishes this relationship is as follows. First, position the patient's body and set the height of the jaw. Adjust the rotation of the patient's jaw. Then, position your own body, including your legs, torso, waist, neck, shoulders, elbows, wrists, fingers, the body of the instrument, and the tip of the instrument. In all surgical procedures, first, obtain proper information. Second, ensure instrument accessibility. Third, adequately protect the surrounding tissues. These three elements are crucial for good surgical results. Information is primarily acquired through visual access, but as a practitioner gains more proficiency and accumulates extensive tactile data across diverse situations, the importance of tactile information also significantly increases. Tactile information transmitted through the hands or instrument tips complements visual information, aiding the practitioner's decision-making for the next action. What is instrument accessibility? If we can't contact the target, we can't alter it. We make contact with something and then alter it, which is the very essence of surgical procedures. The primary goal of retraction is to prevent the soft tissues and the tongue from obstructing both the visibility and the accessibility of the area. Retraction's second aim is safeguarding vulnerable areas. Likewise, suction's primary goal is to keep the view clear from blood, saliva, and water, and its secondary purpose is to prevent these fluids from building up too much in the patient's mouth. The light's purpose is solely to ensure visibility. After the information has been fully established, what is required to gain access to the target site is as follows. When the chair position and angle, the patient's jaw and neck angle, the operator's position, the grip on the instruments, and the instrument rest are all properly adjusted, you can approach the patient's target site with the working end of the instrument without putting excessive strain on the operator's body. Setting the rest means establishing the XYZ axis reference frame in 3D space. Bendable instruments can be very useful for posture, and since the operator's fingers are also bendable instruments, they make excellent retractors, good tissue protectors, and at the same time, good sensory information tools. Since the plastic suction tube is bendable, it can be used not only for suction, but also for retraction and protecting surrounding tissues. Additionally, it's necessary to prevent excessive physical strain on the operator's body during procedures. To achieve this, we need to study and establish the most comfortable operator positions for each tooth's target area, including the torso, legs, waist, neck, arms, and fingers. That's precisely what pain-free posture entails. To sustain a healthy dental practice for many years, it's more crucial to take a step back and progressively refine your posture, rather than merely rushing through each procedure quickly. Often, positions break down because we're trying to see things up close and work quickly. Why must we look so closely? It's because we're overly fixated. We depend too much on visual information. Once proficient, we often don't need to gaze so intensely. It doesn't have to be absolutely sharp. Remaining in a microscopic perspective can cause us to lose our bearings. If you've been examining with a narrow, magnified view, sometimes it's necessary to zoom out and take in a broader perspective. If we can secure the necessary information, protection, and instrument accessibility, and establish proper posture for both the patient and the dentist, without the first assistant's help, for every surface and line angle of each individual tooth, then we can refer to this as two-handed dentistry or assist-free dentistry. First assist-free dentistry is accomplished through the implementation of two-handed dentistry. Second assist-free dentistry is accomplished by the thoughtful preparation of the chairside cart and the effective utilization of various items. Third assist-free dentistry is brought about by optimizing the dental software and hardware environments, ensuring peak performance. We'll delve into second and third assist-free dentistry in separate lectures if the chance presents itself. In this session, we'll begin with an in-depth lecture on first assist-free dentistry, also known as two-handed dentistry. There are many notable advantages to practicing two-handed dentistry. Firstly, it completely eliminates the need for a first assistant. Second, since you don't have to consider the assistant's view and accessibility while treating, your hand, arm, and body movements are much freer. Third, the operator's left hand is directly connected to their brain, so it can enter and exit precisely when needed. No assistant can truly understand your intentions better than your own left hand. Fourth, using your left hand for suction and retraction relies more on tactile feedback than on visual cues. Therefore, you can perform suction and retraction without having to look. Fifth, you won't need to purchase any additional expensive items for solo practice that are already widely available on the market. Sixth, as a result of all this, the practitioner finds it easier to work and the patient receives more comfortable treatment. In the upcoming lectures, we will be thoroughly examining a total of 108 short video clips, similar to the one that is currently being played. Why is it necessary for us to have such a large quantity of video materials? Initially, I will proceed to segment the overall frame into 4 distinct sections, specifically categorizing them as the 10s, the 20s, the 30s, and the 40s. Each section can then be further divided into 3 areas: anterior, premolar, and molar regions. Here, each tooth can be subdivided into 9 detailed areas: occlusal, buccal, mesiobuccal, distobuccal, palatal, mesiopalatal, distopalatal, mesial, and distal. This means all target areas of all target teeth total 108. We'll individually address posture for each of these 108 cases. In every single instance, it is crucial that we guarantee the acquisition and also the safeguarding of pertinent information. I'll explain the techniques for securing access. Acquiring information means, as previously explained, securing the field of view for procedures, setting the light, and methods of suction and retraction. In the suction section, we'll cover how to bend the suction tube, how to properly hold the suction tip with your left hand, and exactly where to place your left hand's rest. Protection means we will discuss in detail how to effectively protect the buccal soft tissues and the tongue by utilizing proper retraction techniques. Securing access involves setting up the chair, positioning the patient, and the operator's posture. Regarding the chair setup, we will be thoroughly examining both the angle and the height adjustments of the dental chair. For patient setup, we'll examine the angle of the patient's jaw and the tilt of their neck. In the operator's posture setup, we'll examine the position of the operator, specifically focusing on their torso, legs, lower back, neck, and the placement of their right hand rest. In the operator posture section, we'll focus on how to minimize strain, tension, and pain while performing procedures. Therefore, as previously stated, since we must identify 15 distinct postural elements for each of the 108 target areas, when computed for the practice of two-handed dentistry, this amounts to a grand total of 3,240 specific postural elements. The purpose of this lecture is to systematically organize these aspects, helping you achieve a smooth and natural posture regardless of the situation, target site, or treatment you are performing.